A Filipino infectious disease specialist believes the study of UK experts that face masks could give people COVID-19 immunity. Our health correspondent, Aiko Miguel, will join us tonight to tell us why live. Yes, Aiko.
Yes, Harley, the Department of Health stated yesterday they are further studying whether face masks could give people COVID-19 immunity. Dr. Ron Zinsolante, an infectious disease specialist, explains that it is possible for people to have COVID-19 immunity by wearing face masks, especially in communities. Such study was also published in the New England Journal of Medicine. UK experts explain that immunity is the ability of an organism or an individual to resist a particular infection or toxin by the action or protection of antibodies. Here's Dr. Solante's explanation.
Evidence that face masks, all of us who wear face masks, see no transmission of infection in the community. So indirectly, the face mask protects the individual, and that in itself is defined as immunity against the infection.
Dr. Solante adds that if there is a small number of COVID-19 infections in a community, transmission will be less. He also explains what herd immunity is all about. Dr. Solante emphasizes when a community wears a face mask, although there is a positive case who does not protect himself with a mask, it is less likely for the rest of the community to be infected with the virus. Again, here is Dr. Ron Zinsolante.
You have 20 people in one room wearing face masks, and you have one individual there who will be coughing. All of you are protected, so nobody will be transmitting the infection because you did not acquire the infection because you're wearing the face mask. So you get the immunity because shield coming from the face mask.
Meanwhile, DOH spokesperson Undersecretary Maria Rosario Vergeres said yesterday non-pharmaceutical interventions is not enough. Here is Undersecretary Maria Rosario Vergeres.
But I don't think that non-pharmaceutical intervention can boost your immune system to give you that immunity. Baka ito lang yung talagang preventive measure that can really work, no? Itong combined preventive measures of wearing face mask, wearing face shield, doing physical distancing and hand washing para tayo ay makaagapay hanggang wala pang bakuna and we can live with the virus.
Hurling the DOH has always been reminding the public to boost the immune system through proper and balanced diet and intake of vitamins, plus exercise and sufficient water intake. Dr. Solante also advises the public, while there is no vaccine yet, it is important to avoid getting sick. This should come with refraining from drinking alcoholic beverages and smoking, keeping a safe distance away from symptomatic patients, and even suspect cases of COVID-19. Again, here is Dr. Ron Solante.
You have to keep yourself healthy aside from the health protocol, no? Healthy in a way, yung exercise, don't drink. Kung meron kang hypertension, may diabetes ka, drink your medication regularly. Based on our patients, mga smokers, taas ng mortality, no? Kasi smokers, because their lungs are already inflamed, doble ang inflammation, mas lalong severe.
Hurling the public should understand that because there is no cure yet for COVID-19, it is part of the new normal to wear a face mask and the face shield, to observe physical distancing, and to wash hands regularly to avoid catching the virus. Hardy.
Aiko, can you also share to us the other contents of the UK expert study you mentioned in your report?
Yes, Harley, to test their hypothesis that population-wide masking is one of those strategies they need to further study, comparing the rate of asymptomatic infection in areas with and areas without universal masking. They also believe ultimately, Harleen, combating the pandemic will involve driving down both transmission rates and severity of disease. Increasing evidence suggests that population-wide facial masking might benefit both components of the response. Harleen.
Thank you so much, Aiko Miguel, for that report.